Alright, today we're going to be doing an NG tube insertion and irrigation. And first thing I'm going to do is I'm going to identify my patient. Hi, how are you? Can you tell me your name? Awesome. What's your date of birth? Any allergies? Okay. Are you allergic to latex? Awesome. Okay. I've already got everything ready here. It's a towel, a basin, a cup full of water so you can drink as we're going down. You can have a little bit even though you're NPO. I got my syringe and my irrigation cup, my little emesis basin, a marker, rubber band and safety clip, the NG tube itself, and a towel. The towel's to protect your gown. I'm going to go ahead and lay that over your chest, okay? Awesome. There we go. Here's my NG tube. Going to go ahead, open it up. Sorry if that hits you in the face. Get it spun around right. Okay. I've already washed my hands and everything when I came in the room. We're going to go ahead and measure the tube. It's going to go from the tip of your nose, around your ear, down to your xiphoid process, which is right there at 50. So that's our mark. And our tube's already marked, which is great. Okay. Going to lay this back out. Going to clean my hands real quick with a little bit of alcohol gel and put on some clean gloves. Here's my clean gloves. And I'm going to put my lubricant here on the paper. Lube about the first 3 to 4 inches. And you're already sitting up at our angle. Here's a cup of water for you. There we go. And I'm going to ask you to set that as I insert this, okay? Okay. Ready? We're going to start the insertion. This is going to feel uncomfortable. I'm going to hold your shoulder, okay? Ready? 1, 2, 3. Starting the insertion. Okay. No gagging. Okay. Now, go ahead and start sipping some water for me. And lean your head forward. There we go. Sip water. Swallow. 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 Oh, you're not gagging. Awesome. A little more. Okay, we're at our mark. I'm going to go ahead and take a piece of tape. I'm just going to tape it to your cheek for a little bit. Okay. So it doesn't pull out. Just going to tape it to your cheek so we can verify the placement. And we're going to verify the placement. But first, can you say hello? Awesome. Can you open your mouth for me? Okay, just looking to see if it cooled in the back of the mouth, which it did not. And ultimately, we're going to have a chest x-ray ordered. You can stay in your bed. They'll come up here, take the x-ray, and tell us if it's placed right. But first, I'm going to aspirate some stomach contents, okay? This might feel a little weird at first, okay? I'm going to go ahead and attach this to our device, which is, I'm going to aspirate for return, and I'm getting good return. It's kind of cloudy green, okay? And now I got a little bit of air in there too. I'm going to take my stethoscope, place it right there in the epigastrium, right there at the xiphoid process, and I'm going to inject slowly, listening for a bubble. And I hear a bubble as the air and gastric contents went back in. And now, if we were to order it, we would draw out the contents and test it with the pH paper, but we weren't ordered to do that. Okay, so next, I'm going to just clean up a little real quick. Okay. You tolerated that very well. Okay, I can disconnect my syringe. Okay, and now we're going to secure it to your nose, okay? Alright, got my tape. Okay, ripped it in a Y. I'm going to untape this from your nose, okay? This might feel a little weird. There we go. You did that well. Now I'm going to take this to the bridge of your nose. I'm going to tape this around it. There we go. Okay. Can you go ahead and turn your head to the side for me? Okay, they turn their head to the side. I'm going to use my rubber band and my paper clip here. I'm going to wrap that around a few times. Pull it through once so that it secures it. There we go, nice and secure. I'm going to undo my paper clip. Not my paper clip, my safety pin. Pin it to their collar. Okay, can you go ahead and move your head up, down, all around for me slowly? Okay, it's all secure, and we would hook this up to intermittent suction if ordered. Okay, and I would document how the patient tolerated the procedure, the attempts of insertions that took the length of the tube, and that is secured to his chest, what nair I inputted it through, and the client response and any instructions I would give to him. His instructions would be try not to turn your head too much or do anything that would pull the tube out. If you feel like the tube is moving, give us a call. We'll come in and assess it, okay? Okay. Next, we're going to go ahead and do the irrigation of the NG tube. Okay, he's had his NG tube for a little while. Now we're going to irrigate it. First thing I'm going to do, address my patient. Hi, how are you? Can you give me your name and your date of birth? Any allergies? Awesome, no allergies still. That's a good thing. Next, I'm going to, if it was connected to suction, I would disconnect it from the suction, but it's not. It's just open hanging here. Okay, so next thing I'm going to do is I'm going to draw. I have my basin and my irrigation container full of water, and I'm going to draw up 30 mils of normal saline, which I need to put some of that back. I got 30 mils of water. I'm going to attach it here. And I'm going to push 30 mils of fluid, and I'm going to do that slowly into the stomach. Okay. And now I'm going to aspirate a full syringe, subtracting what I did. And if I pull out more than 2 syringes, I'm going to attach it back to the suction. Okay, he had a total of 60 mil, 55 mils, 30 of which I just inserted, so he had a total of 25 mils of residual left. I'm going to go ahead and excrete that. And we're going to do this one more time just to make sure. Attach it back. Slowly pull. Okay, I'm getting no more residual at 35. So that's a total of 35 plus 25. 0. That's a total of 60 mils total. You tolerated that very well. I'm going to go ahead and connect this back to suction and wait on the doctor to tell us to DC it, okay? Now I've connected it back to the suction. Okay, and I would document how the patient tolerated the procedure if the NG tube was in the same place, and if there was a large volume and I connected it back to suction, and how much residual there was after I subtracted the amount I put in. And I'm going to just monitor his response and document his response to the procedure.